Okay, I think I've mastered the tech there. It's now a great pleasure of mine to let you meet Kaurna, Ngarrindjeri and Narungga woman. And I must proudly say, as a law and psychology academic, a law and psychology graduate from Flinders University, Ashum Owen. So we've got her bio on the website, and you can see some impressive experience as a legal practitioner, and professional doing other work in and around family law, child protection, domestic violence and civil law. Now Ashum's working as a senior policy officer in the South Australian Office of the Aboriginal for Aboriginal children and young people. So relevant to the debate surrounding the minimum age of criminal responsibility. And if only every state and territory in Australia had such an office, I think Ashum would be doing a bit differently in some states and territories of Australia. And look, I know from many of the raising the age debates in many countries, and would you believe South Korea put their age down last year from 14 to 13 on the advice of criminologists and others, politicians. But law and psychology trained professionals like Ashum are really, really crucial to evidence-based discussions in this area. So I heard Ashum give this 15-minute presentation or so with some other strong women, First Nations women from Kaurna country, and at a conference in November, and really welcome you here today to hear again some of those thoughts, Ashum. Thank you very much.
Thanks, Mark. Can everyone hear me right before I start?
All good.
Awesome. No worries, thank you. I'd like to start by thanking Ngarrindjeri and Yana for some of the discussion you've had this morning. I understand that some of those yarns can be really re-triggering in themselves, and that it's hard to talk about sometimes, but I really acknowledge the work that you're doing in community. I'm coming to you from Kaurna, proud Kaurna, Narungga and Ngarrindjeri woman, but also acknowledge that there are other First Nations people on the chat today, and that you guys are mostly on Ngarrindjeri country. Had a very short stint in Ngarrindjeri country growing up in Dubbo. So that was my little connection there. But yes, I'm now the Senior Policy Officer for the Commissioner for Aboriginal Children and Young People in South Australia. Her name's April Laurie. She's a proud Ngarrindjeri and Ngukufa woman, very strong in her culture, and it's such an honour to be able to work, closely with another Aboriginal woman advocating for our Aboriginal children. I'll just maybe share my screen, that would help.
Should be able to.
Cool. This one. And all right, so I'm talking to you today about raising the age of criminal responsibility. As far as I know, the only states and territories in Australia that have committed to raising the age so far are the Northern Territory and the ACT, who've committed to or have raised the age to 12, even though the experts say that 14 is the standard, and that would produce much better outcomes for children. So my key messages today is that locking children up is harmful. We know that punitive approaches do not work. Contact with the youth justice system at an early age produces much poorer outcomes for those children. We also need to significantly invest in early intervention, prevention and diversion. Like Ngarrindjeri was saying before, they're not getting paid to do the work that they're doing, and that really should be invested in, that why should they be doing that, in their own time? Yes, it's part of our culture, it's part of being a part of a community, but, they really deserve, resourcing for that. My other key message is that every child matters, and we need to not be making the exception the rule when it comes to raising the age. So overall, my presentation is really to provide the perspective of human rights, mental health and wellbeing approach to the argument for raising the age. And throughout it, I'll be amplifying voices of Aboriginal children and young people in South Australia, but also all young people from some various reports that have been published. And at the end, I'll provide the names of those. So the Commissioner for Aboriginal Children and Young People in South Australia is legislated now. She has statutory powers. And within that legislation, what upholds her role is some United Nations declarations. And so one of those is the Conventions on the Rights of the Child. And so one of those articles states that the state shall ensure, to the maximum extent possible, the survival and development of a child. Evidence shows that early contact with the youth justice system produces poorer life outcomes, therefore impairing the development of children and young people. So by not raising the age, Australian government is breaching this convention. And the evidence further shows that Aboriginal children and young people have higher rates of contact with youth justice at earlier points in life, and the outcomes for those children are even poorer. And it seems that the government does not want to raise the age because they do not want to improve outcomes for all children and young people, but specifically for Aboriginal children. And I don't know if you've heard this saying, but I've heard it a few times growing up. If you get it right for our kids, you'll get it right for all kids. And that, I think, really speaks volumes when it comes to raising the age as well. So I think that if we want better outcomes for them, and if government and policy, policy workers believe in their commitment to this United Nations declaration, then they really need to be raising the age. One of the other articles, Article 37, says that no child shall be subjected to torture or cruel, inhumane, or degrading treatment or punishment. Now, the child shall not be deprived of liberty unlawfully or arbitrarily. Detention and imprisonment is to only be used as a measure of last resort for the shortest appropriate period of time. And children deprived of their liberty shall be treated with humanity and respect in a manner that takes into account the needs of that child. They shall not be separated from adults unless in their best interest to do so, and shall have the right to maintain contact with family. Children deprived of their liberty shall have the right to prompt access to legal and appropriate assistance, and the right to challenge the legality of deprivation of liberty, the right to prompt decision on any such action. When I speak about that they have a right to not be subjected to torture or cruel, inhumane treatment, what really comes to mind is the Royal Commission into the detention in the Northern Territory. That evidenced numerous breaches of Article 37, and there are other youth detention centres around Australia that are not dissimilar. So, for example, Banksia Hill in Western Australia was recently highlighted in an episode on Four Corners in November, showing more inhumane, cruel and degrading treatment of children and young people. For those who haven't seen the episode, I just did want to highlight that the Northern Territory government has not fully or accurately implemented the 227 recommendations from the Royal Commission, despite claiming that they have. And the Northern Territory Commissioner for Children and Young People, Nicole Hucks, stated that she was shocked to see the treatment and practices that still occur in Dondale. Children are still subjected to cruel, inhumane treatment. There's currently a campaign to close Dondale, which has been, I guess, in place for many years prior to the Royal Commission. Lots of people wanted Dondale to be closed, but the response has actually been to invest in a new detention centre. Solitary confinement of children is an act of torture, and it has devastating effects on their well-being. Recently, a magistrate in Western Australia said, "If you want to make a monster, this is how you do it," referring to the practice of solitary confinement, which is used quite often in Banksia Hill Detention Centre. And we know that detention and imprisonment is not used as a last resort, one of the contributing factors being the lack of investment into early intervention, prevention and diversionary programs for at-risk youth. And for Aboriginal children and young people, this is also a lack of culturally safe and responsive support services and programs. The rights of Aboriginal children and young people are also infringed, where I put here that they have an inherent right to culture and family. That really is impaired when they are detained in youth prisons. So detaining them from family separates them from their family. Detaining them separates them from their family. And separating them from their family separates them from their community and their cultural identities, which forces new identities to form, and the cycle of recidivism worsens. There's also the optional protocol to the Convention Against Torture, which, if anyone is aware, was supposed to be fully implemented by the 23rd of January, but unfortunately has not occurred. And so the commissioner here believes that the act of locking children up in general is torture, and that really means that OPCAT should come into play at that point. And so OPCAT really is around inspection powers for anywhere that a child is detained. So not just cells, but also mental health wards, the back of paddy wagons. It could be watch houses, which currently I think the Guardian in South Australia doesn't have inspection powers there. So that's just a little insight into some of the rights that I'm referring to. So the impacts on child development, there are a lot of adverse childhood experiences and trauma before children are, I guess, detained, and that can just worsen by them being in prison. So Dr. Katia Malvaso from the Better Start research team at the University of Adelaide has provided some of the data that I'll be referencing in the next few slides, and I think it's really insightful to see just how detention impacts children's development. So studies have shown that adverse childhood events and trauma lead to developmental issues. And for children and young people who have earlier contact with the youth justice system, these outcomes are worse. Not only does experiencing adversity impact brain development, but it can produce poor health outcomes later in life, as well as increase the likelihood of significant social disadvantage. Multiple adverse childhood experiences or events have accumulative effects on young people's brains and well-being. This is a study that was done over a 12-month period involving 184 children and young people who had contact with the youth justice system. So this graph shows various adversities that these children and young people had experienced throughout their childhood. Some notable characteristics of the children and young people who participated: 84% were male, 16% female. Out of 184, 114 were identified as Aboriginal or Torres Strait Islander. 94% were known to the child protection system. 30% had experienced placement in out-of-home care. And 88% of the children and young people who participated reported 4 or more adverse experiences in addition to being detained in youth prisons. The median age, I think, for the children involved in this was about 16. That ranged from 10 to 18. So we can see here that, there's some pretty high emotional abuse and neglect are really up there, as well as family violence, which, I think speaks volumes around what actually is in the control of children and young people. This study then goes on to capture some of the trauma experiences of these children and young people with high rates of adverse childhood experiences and that interaction with the youth justice system. One of the highest trauma symptoms reported is dissociation. How I interpret this is that we're taking traumatized kids and traumatizing them more. We're subjecting them to methods of torture and inhumane treatment. We're not addressing the root causes of their offending, and then we're expecting them to come out well-rounded and rehabilitated. And when you've been traumatized, your ability to make rational decisions becomes impaired. What we need to be doing is giving children and young people the strategies to manage and address trauma, not locking them up. So the effects of early contact with the youth justice system show exactly why we should be raising the age. A child who has contact with the youth justice system at 10 is more likely to experience poorer health outcomes, poorer well-being, is more likely to reoffend, and will likely experience longer sentences and more frequent periods of incarceration compared with children who have contact at a later age. So this is some of the youth justice contact patterns. The graph compares youth justice contact by early or later contact. Early is categorised as contact before the age of 14, and late is anywhere from 14 upwards. This study specifically it followed birth cohorts in South Australia from 1991 to 2002, collected data on contact with not just child protection, but also, with youth justice, but also child protection. And over this period, close to 250,000 children and young people were born. 4,097 had contact with the youth justice system. 16% of those children had contact with the youth justice system at an early age, and 84% had late contact. And these columns show that earlier contact with the youth justice system produces higher recidivism rates. So following on from that, this is a bit of a sad realization of the impact that accumulative adverse experiences in youth justice has on the mental health of children and young people. We can see that, stress-related mental health issues is really high amongst these children who have had contact at an early age. And I think that just speaks of volumes about their trauma that they've, experienced. And like I said before, they're not being taught the skills and strategies to manage stress and trauma and overcoming that. So this is also just showing you the children that had contact with not just youth justice, but child protection as well. And I think there is a very large intersection between child protection and youth justice. I've got some data on that shortly. So we know that Aboriginal children and young people are overrepresented in both youth justice and child protection. This is a snapshot of just some of the figures in South Australia at the moment. Aboriginal children in South Australia represent less than 5% of the total children population in South Australia, but are overrepresented in child protection, youth justice, and what we call dual involved when they're involved in both of those systems. The out-of-home care system plays a role in the criminalisation of children and young people. The Commissioner for Aboriginal Children and Young People has heard that behavioural issues receive criminal responses, particularly in residential care. And this is also the case in the education system, where behavioural issues warrant the police being called to the school. And these are further acts of institutional violence on children and young people. What underlies these behavioural issues is quite frequently undiagnosed disabilities, mental health issues, intellectual and developmental delays. If we take these undiagnosed or diagnosed disabilities and mix them with the data on the impacts of adverse childhood experiences, youth justice experiences, and child protection, what these children and their families need are healthcare responses, strong holistic programs and supports, which are culturally safe and appropriate in the case of Aboriginal communities, but instead they are met with justice responses. So Aboriginal children here just represented in the blue. So I just want to take some time to highlight some of the Aboriginal children's voices. Recently, the Commissioner conducted 38 youth forums around the state. We spoke to 574 Aboriginal children and young people throughout the project. We asked these children what their thoughts were and how they felt about the fact that children could be locked up at the age of 10 in South Australia. A significant number of young people believe that youth detention is not appropriate because children's brains are not fully developed at 10 years old. They're not able to fully understand the behaviour or the consequences. Our young people explained that offending might be occurring due to peer pressure or bad influences. Many questioned whether there were learning difficulties associated with the youth offending, and a large number of young people said detention causes more harm than good, and detention can create further anxiety and stress. These young people really showed wisdom and compassion and very trauma-informed opinions. Our young people have stated that there are many reasons contributing to youth offending, and these must be addressed, including the disconnection of culture for those young people in out-of-home care, stuck in a cycle of offending to avoid their realities of residential care settings. These are the voices of dual involved children and young people. So the Guardian of South Australia recently published a report on dual involved children. The Commissioner has also heard from children in residential care, and that they say that they are criminalised for self-placing, for voting with their feet about where they want to live, They feel that their voices are not being included in decisions about their lives and their care, and this is being met with justice responses. So these next few slides capture all Aboriginal children because the Guardian is responsible for all, not just Aboriginal children and young people. So we heard that children in care feel that they need to create incidents to get attention when they're not being heard or when their needs are not being met by the system. And this can be for something as small as wanting a glass of water from the kitchen. The kitchen is locked up and they need their social workers to unlock the door for them to access water. So I think that was just really horrendous that these children are treated like criminals in the out-of-home care system and then actually criminalised for, I guess, the treatment. Just on the topic of dual-involved children, there's a young sister girl that I know, Brooke. She's a Create consultant. She told the commissioner in one of our forums that the government needs to grow up when it comes to raising the age. So I just think, our children and our young people have the solutions. And we always say that in Aboriginal communities that, we have the solutions and that, we need to be heard and listened and our voices to be amplified. So again, key messages, locking up children is harmful. Raising the age will produce better outcomes for all children and young people. And if the government is committed to the spirit of the Uluru Statement, supporting the statement means raising the age. The Uluru Statement from the Heart, for anyone that doesn't know, there's a section in that says, proportionally, we are the most incarcerated people on the planet. We're not innately criminal people. Our children are aliened from their families at unprecedented rates, but this cannot be because we have no love for them. And our youth languish in detention in obscene numbers when they should be the hope for our future. I've kind of presented some data on why punitive approaches don't work. Investment in early intervention, prevention and diversion really is a necessity. And just as an example, some of the programs that are happening in South Australia, the Department of Human Services has set up a house called Mani Wadley, which means in Ghana, the good house, and can divert children from detention to that house. Unfortunately, I'm pretty sure it only takes one family at a time. So, this is really only impacting one at a time. But I think, that one impact on one child and one family really does make a difference in the bigger scheme. So I guess slowly, but, more investment would really help in that area. And every child matters. We hear a lot that, what about the children that are, I guess, being charged with really violent offences? And that's such a small amount that you're actually causing detriment to so many other children who are locked up for quite minute, petty crimes, that if they should not be the rule. So just to wrap it up, if you haven't seen the campaign Me at 10, it's about raising awareness of raising the age by kind of humanising the issue. So this is me at 10. Here, at 10 years old, I just become a big sister for the second time. And I really loved reading and I love sports and really loved my culture. On the right, this is my nephew, Jarian. He's 8 years old. He's smart, he's loving, he's really deadly at soccer, and he's a big brother to two younger brothers. And I really hope by the time that he turns 10, that the criminal age of responsibility in South Australia and nationally will be 14 or higher. So thank you so much for your time this morning. These are some of the reports that I've referenced and that Better Start research mob at the University of Adelaide as well. Thank you.
Thank you so much, Ashum. Just a wonderfully rich evidence-based presentation there, but just the wisdom and the voices of those young people brings it all to life, as well as the Me at 10 campaign. So wonderful sharing, and thank you very much. I'm going to push our and love in the chat there for you as well. I'm going to push our timetable on, if that's okay, and really happy for chat comments to go in there. I'll save the chat at the end of the day, and we can pass some comments on to you, Ashum, and any questions as well. And I think you're happy for those slides to be shared with our 50 or so people that are on here today, but the hundreds in our LLB as well. And thank you for sharing all that on a Saturday with us, and go and watch some soccer. Eh?
Thank you.
Yeah. Okay. Thank you very much. And good to see a live moving image of you, Dinawan, there as well. And wonderful for everyone to have heard that presentation. Again, I'm going to stop recording and restart.